Hello, all, and welcome to MedicAlert Live Healthy Hour. And we continue our Healthy Hour series to provide our members with additional resources during this unprecedented time. This is really a unique time for everyone, and we're grateful that you're joining us here today. My name is Melody Howard, and I'm the Community Alliances Director at MedicAlert Foundation, and I will be your host today. I've been with MedicAlert for over 30 years, and during those years, I've worked in many different areas of the foundation, and it's truly the members and our mission that keep me going. Today, I'll be sharing information about MedicAlert, about Asthma and Allergy Foundation of America, Asthma and Allergies, Protecting Yourself During COVID-19 Q&A with Kenny Mendez from the Asthma and Allergy Foundation of America, and we'll wrap up the session by providing some useful resources for you. Many of you here today already know about MedicAlert, but for those who don't, I'll give you a brief background. We are the original medical ID created in 1956. Today's discussion includes a subject very near and dear to our hearts, as it's the reason that we were created, and it was to protect a child with a severe allergy. What's unique about MedicAlert is that we go beyond just an ID. Our IDs are backed by a 24/7 emergency response team who are standing by to relay your critical medical information to first responders. And MedicAlert is the only nonprofit organization in the medical ID space. All of our revenues fund our emergency services and help provide IDs and memberships to people in financial need. Our mission is to help save and protect lives by sharing vital information in our members' moments of need. Here's how the MedicAlert service works. Your medical ID is engraved with the most vital health, allergy, and identification information. In an emergency, first responders contact our 24/7 emergency response team to get your full health record. Your health record includes additional health data and emergency contacts, which we relay to emergency personnel. We've trained first responders to look for your MedicAlert ID, empowering them with vital information. Now, more than ever, given the current pandemic, it is so important for first responders to know about any existing conditions so that you can get the best possible care. MedicAlert is your voice when you need us most. I'm delighted to introduce you to our guest today, Kenny Mendez, President and CEO of the Asthma and Allergy Foundation of America. Asthma and Allergy Foundation of America is our newest and exciting partnership, and you'll be hearing more about that in the near future. Kenny graduated from Harvard and Columbia Business School. He has 2 children with asthma and allergies. He joined AAFA in 2018 to lead a multi-year strategic plan to dramatically reduce the impact of asthma and allergies. He also served as an external reviewer and patient advocacy expert for the Institute of Clinical and Economic Reviews. Kenny, I will hand it over to you, and you can talk about the Asthma and Allergy Foundation of America.
Great, Melody. Thank you. Can you hear me okay?
Yes, I can. Thank you.
Great. Well, thank you for having me. And we as an organization, the Asthma and Allergy Foundation of America, or we call ourselves AFA, we're the oldest and the largest nonprofit patient advocacy organization representing those with food allergies, regular allergic asthma, and seasonal allergies. And we try and amplify the patient voice. And we've very much been part of this coronavirus pandemic as it's evolved, trying to communicate best practices and communicate information that we have going out there. So I'm happy to be here. We're based in Washington, D.C., the Washington, D.C. area. We've got a division called Kids with Food Allergies that also focuses on very specifically food allergies for kids and caregivers and how to deal with that. So very happy to be partnered with you in this and speaking to the group today.
Great, thank you so much. Well, now we'll move on to question and answer segment of today's session. Thanks to everyone who pre-submitted questions. We have so many great questions. We do hope to cover as many of those as possible. I want to apologize in advance that we won't be able to get to everyone's questions, but we'll tackle just as many as we can. So let's go ahead and get started. We are actually going to answer questions in the following categories: risk of coronavirus, symptoms, asthma, allergies, or COVID, allergies, in an emergency, outcomes, and lung health. So with that, we have our first question, and category is risk of coronavirus. These questions were actually submitted by a number of folks. I use an inhaler to control my asthma. Will this make me more susceptible to COVID-19? And what precautions should I be taking?
Sure. Thank you, Melody. That is an important question for folks because I think it's top of mind as the CDC has spoken about the risks of COVID-19. Upper respiratory and asthma is certainly something that they've mentioned. But people sometimes are concerned about steroids and the use of asthma inhalers. But what we've been encouraging folks is to stay compliant with your medication. There's no data available out there right now for any kind of risk factors with respect to using your asthma inhalers. So what we've been trying to tell the public is make sure you control your asthma for a number of reasons. One is you don't want to be visiting the emergency room in case you have an asthma attack. So you really want to keep it in control. We have an asthma action plan, which many should know about if you have asthma. We'll be going into that in a little bit. But it's really important to take your medications as prescribed and then practice the common sense social distancing, washing your hands, trying your best not to go outside and really try to not catch the disease.
Great, thank you. And I think this is your asthma action plan.
Yeah, that's right. I mean, this is really important for anyone who has asthma. To make sure that they have this. It's available for free on our website that really talks about how to deal with your asthma and how you're feeling and what you ought to be doing in case you're feeling an asthma attack coming on or if you're struggling with your asthma.
Great, thank you. Also, I want to point out, be making sure that your MedicAlert record is up to date and having an ID that states exactly your condition. The CDC is actually recommending anyone with pre-existing conditions have an ID, especially during this particular time. And question number 2, also risk of coronavirus, submitted by Rochelle. Does uncontrolled allergy-induced asthma put you more at risk of COVID-19?
Yeah, so we have to keep some perspective here. One of the things I want to remind everyone is that COVID-19 hasn't been around for that long, so there's not a lot of good data out there, and that's one of the things that we try and do as an organization. We've got a medical scientific board who is looking at all the data that's coming out there that helps us communicate and give guidance to the public. We're really at the beginning stages of this to really get some data on what's out there right now. But there's no solid data now in terms of allergy-induced asthma putting you more at risk. And in some cases, for example, in New York, there's some evidence of a lower death rate from COVID-19 in patients with asthma. So there's not a lot of data out there right now about it. Again, one of the things that we continue to recommend is keep control of your asthma so you don't end up in the emergency room and have to deal with not only an asthma attack, but possibly catching COVID-19 and having both at the same time.
Thank you. Question 3, submitted by Carol. I have asthma and previously had pneumonia and bronchitis. I'm also type 1 diabetic. I assume I'm very high risk.
Yes. Well, Carol, unfortunately, you're right. The Center for Disease Control, the CDC, includes diabetes as a top risk factor. Asthma may also put you at higher risk. There are a lot of these comorbidities out there right now. So COVID-19 has impacted people of all ages and backgrounds, but according to the WHO, the World Health Organization, and then also the CDC, there are higher risk groups. So, they're as follows. If you're caring for someone with COVID-19, you're obviously at higher risk of catching it if they're nearby you. If you're over 65, that's another risk factor. If you're pregnant, that's another risk factor. And then these chronic medical conditions like diabetes, but there are others that go along with that, which are obesity, high blood pressure, heart disease, renal failure, liver disease. And then if you're immunocompromised, so for example, if you're on cancer treatments, that's another group that's at high risk. And then asthma is there too, along with chronic lung disease, COPD. So all those things together are risk factors. We're also seeing data in the United States in certain populations. I think you've read about this in the press, that Black, Latino, and Native American communities, along with lower income groups, are disproportionately being affected by the virus. And, that's something that's very much on our mind as an organization. And, there really are long-term disparities associated with coronavirus and the treatment here. And the same thing with asthma. So those disparities aren't a surprise to us because we see the same thing with respect to asthma.
Thank you. This question submitted by Kevin and Mary, also risk of coronavirus. How much does having moderate to severe seasonal allergies increase the risk of complications with COVID-19?
Yeah, so let's thank you for that question, Kevin and Mary. Let's dissect this question a little bit, because as you ask, how much does moderate to severe seasonal allergies increase the risk of complications? Well, right now there's no data out there that says that seasonal allergies increase the risk of complications. Again, as I said earlier, it's too new right now. But to the extent that you have seasonal allergies and that's a trigger for your asthma, then that's an issue, because the asthma, and if you have an asthma attack, it could end you up in the emergency room for what I said earlier. So what you really want to be doing is controlling your asthma and controlling your allergies, especially if they trigger asthma. So it's the height of pollen season right now. We're entering into it, spring pollen season, and that can be a real trigger for those with allergic asthma and allergies. So that's something where you want to be taking your allergy medications. Talk to your doctor about that if you're struggling with it. There are steroid nasal sprays that work for your allergies to reduce them, and you want to stay indoors as much as possible. Check the weather report for pollen counts as well, and really try and avoid going outdoors if that triggers your asthma. So keeping your asthma under control and your allergies under control is really a top priority in this environment.
Thank you. Next question submitted by Lang. I have eosinophilia asthma. Should I discontinue injections of Fasenra?
Yeah, again, thank you, Lang. One of the things to remember, again, same theme here. If there's anything that I want to make sure people understand from this, is to control your asthma. So discontinuing or interrupting your treatment could make your asthma symptoms worse and result in possibly having to have emergency treatment for it. So we shouldn't discontinue those injections. However, I know some of them take place in the doctor's office, and some of the doctors are dialing back their office visits. So it's really important to talk to your doctor. I think there's some movement about to be able to either have remote at-home kind of administration of it, if you feel comfortable doing that yourself. That's still not out there yet, but we've been talking to some of the folks who administer this stuff. So it's really important to talk to your doctor first about how to maintain your asthma medications, and in particular the injections that you get to control your asthma.
Thank you. This question submitted by Carolyn. If I have taken pneumonia shots, will they help prevent COVID-19?
Yeah. So Carolyn, I'm glad you asked this question, because the answer is no, and want to make sure everyone realizes that the pneumonia vaccine protects against the bacterial pneumonia. So that's something to remember from streptococcus, pneumonia. So it's not going to protect you against the pneumonia that comes from COVID-19 cases. However, anything you could do to prevent yourself from getting pneumonia will help keep you out of the hospital, stay safe, and not be exposed to the coronavirus. That's one of the things that we were saying early on, back in the end of January. Every year as we get close to flu season, we've said, get a flu shot to make sure that you don't end up with the flu, because that is a real trigger for complications if you have asthma, and could result in pneumonia. So it's really important to not get yourself in a risk situation there.
Thank you. These questions were submitted by a number of you, so it's a pretty popular question. The category is symptoms, asthma, allergies, or COVID. How can I tell the difference between chronic asthma and allergies versus COVID-19 symptoms? And how do you distinguish between symptoms of COVID-19 and allergies and asthma? Is fever the only difference?
Yeah, so that's a great question. If you could advance to the next slide as I talk through the, answering this, because I think we've got a picture here, a graphic, and it's available on our website, AFA.org, and it's something that we've been communicating and updating since, early, the end of January. And this graphic here shows you the various differences between having COVID-19, having a cold, having the flu, having seasonal allergies. And we've been updating it because, for example, the CDC just came out with recent guidelines because, again, the data is so new here, of new symptoms that point to COVID-19. So we try and define them here and we update them on a regular basis. But there are many symptoms that overlap with COVID-19, the cold, flu, and season allergies. So fever, a dry cough, shortness of breath are all the most common symptoms of COVID-19. Sneezing and a runny nose or stuffy nose are more common for a cold or seasonal allergies. So those are things to keep in mind. But if you have any symptoms, you really need to be talking to your doctor. And again, if you're struggling with your asthma or your breathing, make sure you comply with your asthma action plan. And again, talk to your doctor, keep up with your medications, make sure that you stay out of the emergency room, and work with your healthcare provider.
Great, thank you. And I know that this is a lot of great information, and I know that we had a lot of questions concerning asthma attacks and knowing the difference between that attack and what it felt like to have COVID-19.
Sure.
Next section on allergies. A number of folks submitted these questions as well. Should I still take my allergy shots, and should I continue getting allergy shots at the hospital during COVID-19? Yeah,
again, so this is similar to the question about Fasenra and your injectable asthma medications. You do want to keep your allergies under control, but then there's the trade-off of having to go in and get the shots. So regular shots are an effective way to help you manage your allergies and allergic asthma. But because a lot of the clinics have cut back on this for your allergy shots, you really need to be talking to your doctor, and they might be able to adjust the medication or adjust how it's administered so you could kind of keep compliant and not lose ground with the therapy that you're getting. But best thing to do is kind of talk to your doctor, and I think they're working on ways to accommodate having these shots, given that, people are staying at home and some of the practices are dialing back actual office visits.
Thank you. This next question submitted by Laura. I can't get my regular allergy shots and my asthma has been terrible. What can I do?
Yeah, so a couple things. Again, back to that asthma action plan. You want to follow the yellow zone instructions, I think, on your asthma action plan, and make sure to call your doctor to let them know that you're struggling with your asthma. They might be able to adjust your asthma and allergy medication to help you keep it under control. So again, making that call to your healthcare provider. And also try and avoid triggers as much as possible. So if you have pollen allergies, as I said before, try and stay indoors, watch the pollen counts. And again, if you visit, the other thing that we have on our website, afa.org/IAQ, we've got some tips there for improving your indoor air quality. We look at various products out there and certify them using a scientific standard to say that they're asthma and allergy friendly. But really, again, talk to your doctor about your regular allergy shots, and that they should and hopefully will be able to work with you.
Thank you. This question was submitted by Craig. Do any standard over-the-counter allergy medicines compromise the immune system or make one more susceptible to the coronavirus?
Great, Craig. Yeah. So this is the kind of thing that we want to make sure people understand and get out there, that they do not suppress your immune system. So there could be rumors out there, but what we're trying to communicate out there is that OTC allergy medications, antihistamines do not suppress your immune system. There's no data that shows that. And of increasing your chances of getting COVID-19 or any other virus or bacterial infection. So important to keep in mind, and thank you for asking that question.
Thank you. Also in the category of allergies submitted by Sue, how can I avoid bringing outdoor allergens inside?
Yeah, so again, there's some basics there, but if you're outside, leave your shoes outside. When you bring your dog in, if you have a pet, make sure you wash them down before you bring them into the house. That's really important. Switch your clothes, take your jacket off, leave them in a certain place. And then we always encourage you to kind of take a shower, bathe before you go to bed or after you've come outside, because the pollen does get on you physically, and then you could bring that inside. And then when you're indoors, again, if you go to a website, you look at some of the things that we recommend in terms of vacuuming, HEPA filters, other things that you could be doing indoors to make sure that you reduce the amount of pollen and improve your indoor air quality.
Thank you. This question was submitted by Elizabeth. The pollen count is so high that I get winded when I walk outside, even with a mask. What suggestions do you have?
Yeah, Elizabeth, definitely. I hear you, because I experienced that a little bit myself. I've got asthma. Being able to breathe is pretty important, especially when you have asthma. And if you have trouble breathing, I mean, the only thing you could do is avoid situations where you would need to wear that mask outdoors. So what that really means is, if you have to go out and go shopping or something like that, you really maybe need to see if someone can do that for you, or use a delivery service, so you don't have to go out and be outdoors and get winded. Again, if you feel like you're struggling with your asthma, look at that asthma action plan, call your healthcare provider, call your doctor to let them know what your symptoms are. It's critical to have your asthma under control, especially with the spread of COVID-19 around. You don't want to end up in the hospital. So you just want to make sure that you're watching for signs that your asthma is not under control. So if you're having to use a controller, albuterol rescue medication more than twice a week, for example, that probably means that your asthma is not under control, and you need to have a conversation with your doctor if you're having to use that quick relief medication. If you're waking up at night, because of your asthma, that probably means it's not controlled as well. Again, so call your doctor about that. Those are the things that you need to keep in mind. If you're taking oral steroids for asthma more than 2 times a year, that's another warning for you. I know it probably works and provides relief, but you really don't want to be taking the oral steroids more than twice a year. So all those things are kind of warning signs that you need to keep in mind and talk to your doctor about.
Thank you. This was submitted by Heidi. My allergies seem to be exceptionally bad this year, which in turn kicks my asthma up a notch. Is there anything special I can do?
Yeah, I think we covered this, Heidi, a little bit before. Is again, follow your asthma action plan, that yellow zone in the plan, and call your doctor. They may be able to adjust your medications. If you use over-the-counter products, consider getting a nasal spray, because sometimes those are better for nasal allergies than the oral antihistamines. And then again, also control your exposure to your allergy and asthma triggers, again, by staying indoors and vacuuming, using HEPA filters, that kind of thing.
Now our question category is moved to in an emergency. Many folks had actually submitted this question. Will a mask protect me if I need to go to the doctor or hospital?
Yeah. So this is, this has grown as we've watched the coronavirus over time. It's quite controversial. The CDC has recommended it. We've been asking them for very specific guidance on mask use. They do recommend that everyone should wear a mask when in public, especially in places where social distancing is difficult. And, a couple things to just remember here with this question. It's possible, we've seen reports and there's some data out there, it's possible to have the novel coronavirus, but not actually having the symptoms. So that's called being asymptomatic. And then if this is the case, you might accidentally spread it yourself. So what the mask does is it prevents spread from you to others. I mean, that's the primary reason for the mask, and it should fit a very certain way. It has to cover the entire nose and your mouth and chin to be effective. The verdict's still out which masks are most effective for public health. They're obviously the N95 ones, but there are ones that they're telling you that you could do at home, the cloth ones. What we recommend is a mask with multiple layers of fabric that are breathable and can filtrate particles. And you could kind of stick rule of thumb to the flashlight test to gauge the effectiveness. So if you get a flashlight and you shine it through the mask, it should block as much light as possible, but still allow you to breathe. So that's kind of our guidance there. But definitely masks are very important to prevent the spread, especially for those who are asymptomatic. If you're sneezing or you cough, you want to restrict that.
Thank you. Also an emergency. If I have a bad asthma attack, will I be treated at the hospital or am I on my own? This question was submitted by Martha.
Yeah, sure. Martha, I mean, one of the things to keep in mind is you don't want, I mean, there's a lot out there about, visiting the hospitals. We talked about it earlier here, but you don't want COVID fears to keep you from calling 911 if you feel you're having an emergency. I mean, that's really important. You've called them, they will ask you to the extent that you can, someone's there who can speak, if you're having an attack. If you think you need medical attention, call your doctor right away, in terms of your difficulty breathing. But again, if you have an emergency situation, you ought to be calling 911. And that's what's great about this partnership with MedicAlert. MedicAlert has the infrastructure. If you're a member of MedicAlert, I think they have your record, and that's something that's really important and clearly what CDC recommends. But if you are having breathing, you should call breathing challenges. You should call 911. You should call your doctor. And again, keeping your asthma well controlled will help avoid a visit to the emergency room. So everyone should have an asthma action plan and really know what to do if you feel like you're having a bad attack and struggling.
Thank you. Also in an emergency, this one's submitted by Sarah. If my kid has an anaphylactic reaction, should I go to the emergency room?
Yeah. So this is another thing that's changed a little bit with COVID-19 and how folks are treating things. If your child has a severe allergic reaction, anaphylactic, so you're carrying epinephrine, they've used talked about epinephrine auto injectors. You should use that epinephrine immediately and call your doctor. You know, in the past, what they've said is perhaps the standard of care previously was use the epinephrine and then go to the emergency room. The change in the practice now under COVID-19 is use the auto injector right now, call the doctor right away. If the symptoms don't improve, use that second dose of epinephrine, the second auto injector. So for those of you who are familiar with this, you know you should always, if you have anaphylaxis, if you have reactions to certain allergies, you should always be carrying 2 auto injectors. Just in case the first one doesn't work, you want to get the second one in there. And if the symptoms aren't improving, and your child, if you're the caregiver, if that person needs emergency medical attention, definitely call 911 and explain what's been going on. It's important not to avoid emergency care because of COVID-19 fears. But in this case, the slight nuance here is call your doctor right away if you're having to if you administer that epinephrine, and then they can work with you. You know, for example, there's one of the doctors on our board said he had a patient who had anaphylaxis. The caregiver gave the child the medication, and he agreed to stay on the line through the phone and through FaceTime video to observe the child for 30 minutes to make sure he was okay. So they're saying, call your doctor, but they're saying not to go to the emergency room immediately, but have those 2 auto injectors with you and call your doctor.
Thank you. Here's a category of outcomes. This question submitted by Elizabeth and Lynn. Is there any data that you could share about patients with asthma who have contracted COVID-19? Specifically, what has been the fatality rate?
Yeah, so Elizabeth and Lynn, this is a question that we've been struggling with and trying to keep monitoring because, as I said at the beginning of this presentation, the pandemic and the data that we're getting when people with asthma who have contracted COVID-19 is still in its early stages. So there's not a lot of great data out there, and there's some conflicting data on how it's communicated. There have been some early reports out of Wuhan, Europe, and New York that indicates that while asthma may increase your risk, it may not be as high of a risk factor as obesity, high blood pressure, heart disease, diabetes, kidney failure, liver disease, and some of the other secondary health problems I mentioned earlier. So again, it's important to continue to follow your asthma action plan. I kind of a broken record here, but just want to make sure you guys take away that from this meeting here, this event, and keep it under controls. Doctors have pointed out that having asthma under control is better than struggling to manage it along with virus at the same time. So that's the other thing to keep in mind. So unclear about the fatality rates, still need more data on that.
Thank you. Here's a question submitted by Gina. Can one get reinfected with the coronavirus?
Yeah, so Gina, the WHO, World Health Organization, says there's currently no evidence of that right now that shows people have recovered from coronavirus and are not at risk for getting it again. So it's still early though. There's not enough data out there. You've read a lot about antibody testing, and that can show if you've already had the virus. But having the antibodies doesn't necessarily mean you'll be protected from getting COVID-19 again. There's just not enough data out there yet.
Thank you. This category is lung health. This question was submitted by Edith and Carrie. Why is there a run on asthma inhalers?
Yeah. Edith and Carrie, we've been spending a lot of time on this, talking to the manufacturers of the medication, talking to the pharmacies, talking to the health insurance plan. What's happened is this is demand driven. There are 2 things that just recently happened with the CARES Act that just passed with COVID-19. The government allowed you to fulfill prescriptions, 90-day prescriptions without prior authorizations. So that was to avoid you having to go in to the pharmacy directly. So there's increased demand there because people want to get their medications up front. So there's demand that way. But the other wrinkle that's going on, and I think there was a question in the chat about this as well, is some of the treatment and standard of care for asthma and some other respiratory issues is to use a nebulizer with albuterol. And albuterol is what's in some of those canisters, which is the rescue medication. And sometimes that is administered through a nebulizer that creates a mist, an aerosol, where you can inhale that albuterol as a rescue medication. But in using that nebulizer, it also, as you inhale it, you exhale it, it spreads the virus. So they've changed that. And there's been more of an increase. They've recommended not using nebulizers in a hospital situation or in a clinical situation, and instead use the inhalers that contain the albuterol, and you use it with a spacer. That's the best practice for it. And so that's where the demand has increased. It's flipped from using nebulizers to using canister inhalers for treatment here. So that's where the increased demand has come from in some of the hospitals. What we've tried to communicate, what's really important, is keep a 30-day supply on hand, but don't stockpile. I mean, because that doesn't do anyone any good. We're trying to keep listening. We've sent a survey out just to hear whether there are shortages. There might be some spot shortages that we've heard around the country, but what's really driving the run or some of the shortage rumors on asthma inhalers is this change in treatment combined with folks trying to fulfill their 90-day prescriptions.
Thank you. Also on lung health, submitted by Kathleen, how do I deal with disinfecting agents that are irritating to lungs and cause asthma, like hand sanitizer and bleach solutions?
Yeah, that's a tough one. And in fact, interesting story, when we're based here in Washington, D.C., just outside of D.C. in Arlington, Virginia. And when we started hearing reports of, there was one person who had we're in a 12-story building, and they had one person in that building who was reported having coronavirus. So right away, they went to start cleaning everything. And for some of us on staff who have asthma, those were real triggers, the cleaning solutions in their effort to try and disinfect from the coronavirus. So it's hard to avoid some of these harsh chemicals. And that's one of the reasons why I said early on is like, okay, if these chemicals are getting to you, you can work from home. That was until we had the full work from home order. But it is challenging for if you have reactions to these smells. So if you can't find unscented products, there are a few things you could do to reduce your contact. Again, it gets back to some of the basics here, which is washing your hands with soap and water for 20 seconds, because we know that the virus is transmitted from touching a surface and then going to your face or your hands. So if you wash your hands for 20 seconds and wash them well, it removes the virus. If you have to use hand sanitizer, make sure that you keep it away from your face after you immediately put it on, because sometimes there's sense in that. And, so rub your hands together, but try and keep them away from your face, given it any kind of fragrance that comes off on it. So scrubbing surfaces, simply with soap and water will work. And so, again, that would avoid some fragrance. But you could also try using a mask when you use those cleaners. And just always remember, don't ever mix cleaning solutions. That's kind of a no-no as well. So there are some formulas here. If you want to use bleach solutions, mix a 1/3 cup of bleach, I think is what we advise with water. Just carefully mix those together, but never mix it with anything else. But I do know that bleach is a trigger. It certainly is for me when you smell it. So it really depends. I mean, sometimes you might just have to leave the premises and have someone else do the cleaning. until you could come back and those smells and gases are out of there.
Thank you. Also on lung health, submitted by Karen. If all of us will eventually be exposed to COVID-19, how can an asthmatic best take care of himself?
Again, thank you, Karen. People with asthma can best take care of themselves, again, by keeping their asthma under control, well controlled, and staying as healthy as possible. That's really critical. Manage your asthma so you don't have attacks. Take your medicines every day as directed by your doctor. Again, follow that asthma action plan. Make sure you understand when you're struggling, and then call your doctor in case you need to adjust your medication. And again, in this in the allergy environment, the pollen season, avoid going out. I mean, you're supposed to be avoiding going out now anyway, but if there's strong pollen release, you're seeing that on the weather report, don't go out, because if allergies trigger your asthma, you want to make sure to take care of yourself there. And then, common sense stuff, get plenty of sleep, try and manage your stress level, eat well. I mean, all those things have an impact on your health and all these chronic conditions. So in this environment, we'll see, as you go back to work, that's the big question, how are we going to deal with this going forward?
Thank you. Also, just as a precaution, make sure you have your MedicAlert ID on in case something happens and your information is up to date. Looks like we have a few more minutes for some questions. So I won't advance the slides, just so you know that question won't change. But we have a question from Eileen. What are the health recommendations during this pandemic for people with food allergies?
Yeah, I think, the same thing, that the key one that I mentioned to you is that if you have a need to use your epinephrine auto-injector, so if you're having an anaphylactic reaction, make sure to call your doctor immediately so they know that you're using this, and that they can advise you on what to do, whether you need to go to the emergency room, having that second dose available. So that is, in a worst case scenario, important to have. And, for those of you on MedicAlert with your IDs, and, that the infrastructure, I think, at MedicAlert would probably advise you the same thing, given some of these changes. And then with the food allergies, we have surveyed our community, and we understand it is tough, because with some of the delivery, some of the food shortages that might be out there, the bare shelves on, in the supermarkets, some of the foods that you're used to using, which are reliable, aren't there anymore. So what we'd really advise is just read the labels very carefully to make sure that there are no allergic triggers in there that someone might have an allergy to. And then clearly, if you have it, make sure if you need to, call the manufacturer and see whether they could let you know if there's that specific allergen in there. But sometimes manufacturers aren't always that helpful, but that's what we recommend to do.
Great. I have a question from Kathleen. Are there any statistics on the number of children with asthma that have been diagnosed with COVID-19?
I wish there were, but there aren't right now. I mean, again, as I said earlier, it's too early to tell right now. There's not enough data out there. I think they have the age group, the age demographics, the approximate age demographics. It's quite small for the younger age groups. And I said, as I mentioned earlier, that those who are over 65 are more susceptible to COVID-19. That's the higher risk group.
Great. Also a question from Cheryl. How do patients with asthma and lung disease know when it's safe to return to a normal life and work, and what precautions do we need?
Yeah, so, I think there are a couple things here. Again, work with your healthcare provider to make sure that they know what your condition is and how you're feeling, so your medications are appropriate and at the right levels. Again, I think as we go out there, if you're in a high risk category, having a mask, still practicing social distancing as you go out there. We're fully expecting that things aren't going to be normal when you go back to work. So if you are in a higher risk factor, make sure you practice all the things that you've been practicing right now when it's time to go back to work, because things might not change that much. It's still quite the same. There's no vaccine for this right now. So I think you have to continue to protect yourself in the same way you are right now. Protect your asthma first, make sure it's controlled, understand how you're feeling and what medications you need, work with your doctor, and then make sure as you think about going back to work that you have a plan and practicing social distancing, washing your hands, all the things that we've been doing now.
Thank you so much. I have a question from Carol. How can I boost my immune system to have better lung health?
Yeah, Carol, I think we talked about some of that stuff earlier, which is getting good sleep, living healthier life. I mean, that's good for your immune system overall. I don't think there are any very specific things you could do. I mentioned, when there's pollen right now, and it's the height of pollen season, making sure you stay indoors or use indoor air quality and cleaners, vacuum cleaners inside with HEPA filters. Absent that, just trying to lead a healthy life, getting good sleep and eating well, and working with your doctor is probably the most important thing you can be doing for your immune system and your overall health.
Great, thank you. And this question just in from Mary. Do asthmatics need nebulizers, oxygen concentrators, and blood oxygen level testers on hand?
Yeah, again, I don't know that you need them on hand specifically. I mean, some of you might have nebulizers already because your doctors, I know when my son, he got his first nebulizer treatment at 9 months old, and we had that at home. He's in his 20s right now, but I remember that first treatment, so we had them at home and we had it on hand. So your doctor will tell you if you need that nebulizer at home. There's been some press about the pulse oximeters out there right now, and we're running that through our Medical Scientific Council because that monitors and can provide some monitor on your oxygen levels in your blood, and that could be an early indicator if you're having issues with respect to breathing and lung health. So those things are very much on our radar right now, and stuff that we'll be looking at and keeping in mind going forward.
Thank you. Deepalia has asked, can asthma be cured completely? And if not, which medications are best to control it?
Yeah, so unfortunately, there's no cure for asthma right now. 3,600 people die a year from asthma, so it can be serious. So what the practice right now is to try and control it as best possible. So what I was talking about earlier was albuterol as a rescue medication. So that's if you are struggling and you are having trouble breathing, taking the rescue medication should help you improve your breathing. And then there are controller medications that have some combination of the albuterol, but also inhaled steroids that will reduce the inflammation in your lungs. So those are the two different kinds of medication that are commonly used in moderate to severe asthma. And then per the question earlier, there are biologics out there right now where if all those don't work for you in a maintenance form, then having injectables and those biologics tend to work for some people and can be game changers for some in terms of controlling your severe asthma. But again, that's working with your doctor to determine what the best approach is there. There's also a medical procedure called BT therapy, bronchial tracheal therapy, where it's a little bit more aggressive, but that's a physical procedure that you could have on your lungs. All those options are things that you should be talking to your doctor about as you discover you have asthma and monitor your asthma action plan. Their doctors are very much aware of the asthma action plan and will test you or talk to you get a sense for how you're feeling when you come in and adjust your medication accordingly.
Great. Looks like we have time for about one more question, and this is related to going back to our normal lives. We're not feeling that our 9-year-old with asthma should attend school when it opens, being more vulnerable to a serious COVID-19. What do you recommend? This question's from Deborah.
Yeah, well, I think it's really going to depend on the school district and kind of what your comfort level is and working with the school. So, for example, I mean, these are completely different times, but I could just use an example with respect to food allergies specifically, but this is also the case with asthma. If you're sending a child back to school and that they've got specific respiratory issues, asthma or food allergies, the school has to be able to work with you to accommodate those specific conditions. So if you go to our website, apha.org, we've got some guidance on there in how to approach the school if you have asthma and allergies, if your child does, and ways you can work with the school to go back. Now, with that said, many of the schools are closed down now, and we're not sure what's going to happen going forward. So I think that that's a great unknown, but I think making sure that the school knows your child has asthma or life-threatening food allergies is very important as you get as we start to go back to kind of the school environment.
Great, thank you. We actually do have time for one more question. I have one last question. It's from Paige. As a child care provider, how can I support children with asthma and allergies and their families?
Yeah, thank you for that question, Paige, because we rely on you, and in fact, many of us will have to rely on you when we go back to work, and we trust our kids with you. I'd say, first off, really understanding allergies and asthma, so the asthma action plan. I think there'll be some slides later in terms of where you could go on our website. It's all free information. But to the extent that you can understand asthma, allergies, food allergies, if you're a caregiver and the children have any of those, is really helpful to us as parents. I mean, clearly for me, when my kids were young, having someone, if we had a babysitter in or a caregiver, making sure we felt confident in them, that they knew what to do in an emergency is really important. So I think, that's one of the great things about this partnership with MedicAlert, in that, they have the infrastructure, they have the procedures to help their members know what to do in the event of an emergency. It's right there on the bracelet. But as a caregiver, as someone who's caring for kids, is knowing what to do in an emergency and then understanding all the things related to food allergies, for example, cross-contamination is one issue. And then also being sensitive to that sometimes these kids can get bullied in school and are often bullied, and just trying to help them with that as well, I think could be very reassuring to the kids and to the family and to the parents.
Kenny, thank you so much. Can you tell us more about some of the resources that APHA provides for people with asthma and allergies?
Sure, I'd be happy to. I think we've got a couple slides here. This slide here, we talked a lot about this, but we have a blog that we update on a regular basis, and it's titled Coronavirus, What People with Allergies Need to Know, with Asthma Need to Know. So these are the links here. The head of our Medical Scientific Council, Dr. Mitch Grayson, has also written some things, again, talking about complying with your medication. We covered a lot of this just in the Q&A here. If you flip to the next slide, we can see what else is, what you've got there. The other thing to remember, we just talked about food allergies, and there was a good question about that with respect to COVID-19. The thing we didn't get to is eczema. These are all the same immune system response. Eczema is atopic dermatitis. They call it the atopic march, but food allergies, asthma, eczema are all kind of the same immune system response. It just depends on the varying levels and who has it. But when you're doing a lot of hand washing, there's tendency to be skin irritation, so that could be a trigger for eczema. So we've got some advice on the website on how to deal with that. Go to the next slide. And then our team is keeping in contact. We had a little bit of dialogue about the shortages of albuterol, so that's one thing we're keeping an eye out for. But also, as we hear about healthcare coverage opening up, some states opened up open enrollment given folks losing their jobs and not being at work. So we tried to alert our community about that. We'll continue to do that. And as we get more information, as this has changed for us, you know, it can change on a daily basis. We try and update that information and keep it on our website. So, you know, definitely visit there. If you go to the next slide. I just talked about drug shortages. So this one here, no, you could, well, I just paused. You could back up 1 second. Here's an example of if you go back one slide on the albuterol drug shortages. We, you know, again, are working with the FDA, but there was recently a new generic that just came out for albuterol. So that's something that we try and alert people to. So again, as you subscribe to our email list, or register in our community, and that probably brings us to the next slide here, where one of the things that we have is an online community. It's completely free. You can log in, and there's a support network there. There are people who are experiencing what you're feeling, or you could ask questions of them, and they'll answer it. So it's a little bit safer and more protected because it's moderated than Facebook. We're also on Facebook and some of the other social media platforms. We also have an Ask the Allergist. So if you have a question, we can send it to our medical scientific council and get it answered for you in a couple of days. So there's updates on research, a lot of things there. So if you go to aafa.org/join, aafa.org/join, you can find us there. There's also a button, I think, saying get support. If you go to the next slide, the other thing to remember here is if you want to learn more, so someone asked a question about what can I do as a caregiver for a family. If you want to learn more about asthma, we've got, and allergies, we've got online learning there, which is available to you. These are self-paced courses. In some cases, I think they're free. We have a partnership with the CDC, where we've developed this online curriculum. If you flip to the next slide, you can see what they look like. So when you go there, these are various courses that we have. So someone asked about, you know, how you deal as a caregiver. We've got managing your child's food allergies. So that would be appropriate. Severe asthma care for adults, you know, that's one. Asthma care for adults is there as well. And then asthma management education. Those are for healthcare professionals. But again, all those are available on our website. The other thing I'd say last, probably this is the last slide, I think, but we have an online recipe database that's tested and populated by those who are in the community. So I remember, you know, once our kids were diagnosed with food allergies, when the first one was diagnosed with a food allergy, you needed to know how to put a meal on the table and what recipes to use. And so that's a resource that we provide and want to make sure that you know that's available completely for free. And you could go to our website and find that there on the AFA website, or you could go to kidswithfoodallergies.org/recipes. I think it's on there, and you can find those recipes there.
Great. Kenny, thank you so much for being our guest today. This has been fantastic, but there's so many questions we didn't get to. I hope you'll come back for another session.
Yes, definitely will. And again, afa.org, if you've got any questions there, register in our community and we're happy to answer them, but also look forward to coming back again and working with your membership here.
Great, thank you. Please visit our Coronavirus Resource Center, which has some really great information from trusted resources. And also, if you enjoyed today's discussion, feel free to see our past Healthy Hour recordings in that area as well. Also, to let you know, we will be having another Healthy Hour in approximately 2 weeks. We'll be announcing that topic and date shortly, and you can get to the page here to register. Also, we love feedback about our session today. So if you don't mind answering our question that comes across your screen, I'm just going to talk through a little bit more while you're doing that. Stay safe and stay healthy.
Great.
We'll see you
Thank
next
you.
time.
Thank you, Melody.
Thank you.